Let's talk about schizophrenia. It's a word we hear a lot, but it's surrounded by so much mystery and, frankly, a lot of stigma. In this explainer, we're going to cut through all that noise. We're going to build a real, clear understanding of what it is, what it isn't, and most importantly, why there's real reason for hope. So let's dive in. I want you to start by just thinking about this question. I mean, really think about it. Imagine is the one tool you have to understand the world. Your own brain started feeding you information that wasn't quite right. That's the fundamental challenge we're talking about here. It's a profound disconnection from the reality that most of us take for granted.
So, to really get it, we have to go beyond the Hollywood stereotypes. What does it actually feel like to experience this? Our first step is to explore the symptoms that define this illness, not from the outside, but from the inside out.
At its heart, schizophrenia is a long-term illness that really just changes how a person experiences the world. Now, let's get one huge misconception out of the way right now. This has absolutely nothing to do with having a split personality. That is a damaging myth that just won't go away. The reality is much more about the mind's core functions being disrupted, creating a break from the world everyone else sees. Now, the way symptoms are categorized can be a little weird. Positive symptoms don't mean they're good. Think of it like math. Positive means things are added to a person's experience, things that shouldn't be there, like hallucinations or delusions. On the flip side, negative symptoms are things that are taken away or subtracted, like the ability to feel joy or the motivation to do things. Getting this difference is absolutely key.
And, it's so much more than just the psychosis that we always see in the movies. The illness also causes major cognitive issues, making it hard to focus, to remember things, to solve problems. And then there are the affective or mood symptoms like crushing depression and anxiety. These struggles, the ones you can't see, are often just as debilitating, and they're a huge reason why the risk of suicide is tragically high.
Okay, so that's what it feels like. The next question is pretty obvious. Why? What's going on that causes this to happen? In this next part, we're going to dig into the science, and we'll use a pretty powerful analogy to make sense of it all.
The best way to think about the cause is with this saying. It really captures the main theory perfectly. Genetics load the gun, stress pulls the trigger. It's not this simple debate of nature versus nurture. Nope. It's the powerful and often heartbreaking way the two interact. So let's break that down, right? Loading the gun is all about genetic risk. This could mean having a parent or sibling with the illness, or having certain differences in brain structure, or even imbalances in brain chemicals like dopamine. But a loaded gun doesn't go off by itself. Something has to pull the trigger. And that's usually an environmental stressor, like trauma, intense stress, drug use, or even problems that happened before you were ever born. We've looked at the science, but a diagnosis isn't just a concept in a textbook. It's a moment that changes a person's life forever. So what does all this actually mean for someone just trying to live day to day? Let's talk about the real-world human cost. When you put all those symptoms together, the positive, the negative, the cognitive ones, just getting through the day can become a monumental effort. Simple things like taking care of yourself, holding down a job, keeping up with friends, they can feel almost impossible. This often leads to a massive loss of independence and a really painful kind of social isolation. Now, just take a second and let this number really sink in. A potential loss of 20 to 25 years of life. And here's the crucial part. This isn't because of the mental illness itself. It's because people with severe mental illness often have physical health problems that just don't get treated properly. It is a brutal reminder that you absolutely cannot separate mental health from physical health. Okay, so that reality is incredibly tough. I get it. But, and this is a really big but, there is so much hope. So let's shift gears and focus on the path forward. Let's talk about modern treatments and how they can help people manage the illness and rebuild a life.
Medication is, without a doubt, a cornerstone of treatment. The first-generation drugs, the older ones, were game changers, but they really only helped with the positive symptoms and had some serious movement-related side effects. The newer second-generation meds are often better because they can treat both positive and negative symptoms, but they come with their own risk, mainly for metabolic problems like weight gain.
And speaking of medication, we need to pause for a second. This is a critical safety warning. It's very rare, but a potential side effect of these drugs is a condition called neuroleptic malignant syndrome, or NMS. And to be clear, this is not a minor issue. It is a life-threatening medical emergency and something everyone, especially family, needs to know about. The most important thing is to be able to spot the signs, and there's a great way to remember them: the word fever. It stands for a high fever, encephalopathy, which is just confusion or a change in mental state, vitals being unstable, elevated enzymes in the blood, and severe muscle rigidity. If you see this pattern, you don't wait. You get emergency medical help immediately. But listen, treatment is so much more than just a prescription. A truly good approach looks at the whole person. We're talking about things like cognitive behavioral therapy to manage difficult thoughts, family therapy to build up a strong support system, and really practical training to help with social and job skills. It's all about treating the person, not just the illness. And that brings us to our final section, which is all about a really fundamental shift in how we approach long-term care. It's about moving toward what we call a model of recovery. You know, this modern approach, the recovery model, it has changed everything. The goal isn't just symptom control anymore. It's not about searching for some magic cure. The focus now is on empowerment. It's about helping a person build a meaningful life despite their illness by focusing on their strengths, their hopes, and their own goals. And this doesn't happen in a vacuum. It takes a whole team. The psychiatrist is there for the meds, the therapist teaches coping skills, the social worker helps navigate all the practical stuff like housing. Everybody has a role to play, and they all work together to support the person on their journey. We've covered a ton of ground here: the experience, the science, the human cost, and the treatments. So what's the one big idea you should walk away with from all of this? What's this right here? The goal isn't to make the illness disappear. It's to help a person build a life that is so full of purpose and joy and connection that the diagnosis becomes just one chapter in their story, not the whole book. And that leaves us all with a final question to think about. This isn't just for doctors or therapists. It's for all of us. As a society, as friends, as family, how can we fight the stigma and give people the support they need to build that life? That's something for all of us to consider. Thanks so much for taking the time to understand.